Imagine a miracle drug. It would help you live longer, feel less pain, have lower blood pressure, sleep better, increase your immune system, heal more quickly. Every healthcare organization in this country would invest in it, would prioritize it, and would embrace it. It could be a centerpiece of holistic care. Yet it's not a drug. It's gratitude, and it's free. Gratitude has often been dismissed as a lightweight emotion. However, science, coming from psychology and neuroscience, demonstrates that gratitude is actually a very complex moral disposition. It's a complex virtue. It's aligned with how we make moral judgments and how we prioritize the things we value in our lives. When you think about gratitude on a spectrum of thankfulness, you have at one end appreciation, where we just see the positive benefits of a person or thing. On the other end, we have obligation, where someone provides a benefit to us and we feel compelled to pay them back. It doesn't feel good. But right in the middle of that, we find gratitude. With gratitude, we recognize that someone has done something for us that we often could not do for ourselves. It's something that is valuable to us, meaningful for us, and because of that, we are intrinsically motivated and moved to express thanks to the person who stepped up for us. When we think about that spectrum, you've got to think about gratitude in the healthcare organization, because we've talked a lot recently about grateful patients and grateful families. When you go into the healthcare organization and if someone does something nice for you, one of the first things that you ask is, why? Why did they do this for me? And they say that they will bucket why you did it into one of three categories within about 2 seconds. First, you did it because it was your role, it was your job. You were a nurse, you were a transporter, you were a phlebotomist, whatever it was, you were just doing your job. Secondarily, you looked at someone and you said, oh, maybe if I do something for them now, they'll do something for me later. So there's an economic exchange, a cost-benefit analysis. But the third reason you step up and do something was rooted in genuine goodwill. You looked at another person, and through your shared humanity, you wanted to step up and you wanted to help them. So when we think about coming into the healthcare organization, the other thing you've got to consider is that gratitude is based on something that is unexpected, unsolicited, and unearned. So think about what people walk into our healthcare organizations with. They've got a Medicare card, a Medicaid card, an insurance card, or a credit card most often. And so when they come to us, they feel they have made an economic exchange with us to get an accurate diagnosis and appropriate treatment. So what rises to the threshold of sparking gratitude rooted in genuine goodwill? When we feel gratitude that is rooted in genuine goodwill, it's going to make us want to go and connect with other people. To what Sarah Algo from the University of North Carolina, Chapel Hill says is about find, remind, and bind. When we want to go and connect with other people, it's almost always because of compassion, kindness, empathy, and connection to social and emotional needs. But you've got to think about patience, that often people will say, are we preying upon people who are fragile and vulnerable? Are we putting someone in a difficult position? And the answer to you resoundingly is no. That patients are moved again and motivated to go and connect with you. It is their choice to utilize their other-centeredness to connect with the organization. And so when we consider what would motivate people to give a charitable gift to a hospital, we see that it is often about desire to express gratitude for care. Secondarily, other things like outcomes come in, but it is truly rooted in gratitude. Now with that, I don't want to give short shrift to the other ways that people are going to express thankfulness, that many are going to want to connect with us for words, through hugs, through handshakes, through advocacy, through storytelling, through volunteerism. But we find that the motivation to give a charitable gift is so impacted by gratitude that we've got to really understand this, embrace this in a meaningful way. So again, going back to compassion, empathy, and kindness, we know those are going to be really important, and they're about the social and emotional dimensions of care. But I think as we consider gratitude, we have got to be emboldened to think more broadly than philanthropy. Our opportunity here is simply bigger. Gratitude not only can advance charitable giving, but it can address some of the most important and most challenging strategic needs in healthcare at this time. One of the things that we must consider is that about a quarter of our nurses and half of our physicians are experiencing burnout. Because of this burnout, we see increased absenteeism. We see people leaving the profession. We see emotional exhaustion, physical exhaustion, and we see people who say there is no longer purpose to their work. It is a national healthcare crisis. And yet, what we can see in multiple studies is that when a culture of gratitude exists in the organization, it decreases emotional exhaustion. It increases purpose in work. It makes people more resilient. It makes them more joyful about what they're doing. And so creating a culture of gratitude in our organization where we don't just nurture and harvest it from patients, but we also thank our patients for choosing us or for letting us be part of their life. Or we thank each other as caregivers for the roles that we play together. It means that it decreases burnout in our organizations. So the other thing we've got to consider is when you have caregivers who are better taken care of and who are more emotionally resilient, they provide better care. They utilize discretionary effort for the organization. And when they do that, we see better clinical outcomes. We see better patient experience. And so having a gratitude as part of our workplace also improves our outcomes for the organization. Melanie, will you flip to my next slide? This is not working for some reason. Thank you. So patient experience, has become one of the top differentiators for healthcare. It's critically important, especially with the rise of consumerism in healthcare. So again, the need to take care of our caregivers is going to be critically important for the organization. We've also got to consider how gratitude is going to help to build our tribe. One of the other challenges we see in healthcare right now is a decrease in loyalty to our institutions, that people are more likely than ever to shop, to go to other hospitals. They say you are as likely now to change hospitals as you are to change wireless phone providers or to change hotel chains. Certainly those are not thoughtful choices. Yet when people bind to us through gratitude and establish a relationship with us, they are more likely to refer, return, be loyal, be advocates. And so we've got to consider that opportunity we have to build our tribe. So when you think about gratitude, not so simple. Gratitude can, in fact, be one of the most powerful levers you have, can be a tremendous catalyst to not only elevate philanthropy, but to elevate healthcare. As you consider this incredible opportunity before you, I would encourage you to be system thinkers and think about yourselves not as just nonprofit executives, but as healthcare executives who have an incredibly valuable solution to help advance all of the strategic priorities of your organization. Thank you for spending these few minutes together today.